Conducting physical examination. Here are the steps on how to conduct physical examination. Step 1. Infection. Inspect each body system using your vision, smelling, and hearing to check for normal conditions and differences. As you assess each body system, check for color, size, location, movement, texture, symmetry, odors, and sounds. Inspect the head, eyes, ears, mouth, nose, arms, posture, and gait of the client. Step 2. Palpation. Touch the client with different parts of your hands using different degrees of pressure. Make sure to keep your fingernails short and your hands warm. Wear gloves when palpating mucous membranes or areas in contact with body fluids. Palpate tender areas last. There are two types of palpation: light and deep. Light palpation is used to feel for abnormalities on the surface. Depress the skin 1/2 to 3/4 inch or about 1 to 2 centimeters with your finger pads using the lightest touch possible. Check for texture, tenderness, temperature, moisture, elasticity, pulsations, and masses. Meanwhile, deep palpation is used to feel internal organs and masses for size, shape, tenderness, symmetry, and mobility. Depress the skin 1 1/2 to 2 inches or about 4 to 5 centimeters with firm, deep pressure. Use one hand on top of the other to exert firmer pressure if needed. Step 3. Percussion. Tap your fingers or hands quickly and sharply against parts of the client's body. This helps in locating organ borders, identifying organ shape and position, and determining if an organ is solid or filled with fluid or gas. There are two types of percussion: direct and indirect. Direct percussion reveals tenderness. It is also commonly used in assessing adult sinuses. Using 1 or 2 fingers, tap directly on the body part. Ask the client to tell you which areas are painful. Watch his or her face for signs of discomfort. On the other hand, indirect percussion brings out sounds to give hints to the makeup of the underlying tissue. Press the distal part of the middle finger of your non-dominant hand firmly on the body part. Keep the rest of your hands off the body surface. Flex the wrist of your non-dominant hand. Using the middle finger of your non-dominant hand, tap quickly and directly over the point where your other middle finger touches the client's skin. Listen to the sounds emitted. Step 4. Auscultation. Using a stethoscope, listen to various sounds coming from the lungs, heart, and bowel. Be alert and take note of abnormal sounds, especially those that come from the lungs. To prepare for the auscultation, make sure that the environment is quiet. Expose the area to be auscultated. Clothing or bed linens can interfere with the sounds. Warm the stethoscope head in your hand. Close your eyes to help focus your attention as you listen to the sounds. Follow the steps to know how to auscultate. Use the diaphragm to pick up high-pitched sounds, such as the first and second heart sounds. Hold the diaphragm firmly against the client's skin, using enough pressure to leave a slight ring on the skin afterward. Use the bell to pick up low-pitched sounds, such as the third and fourth heart sounds. Hold the bell lightly against the client's skin, just hard enough to form a seal. Holding the bell too firmly causes the skin to act as a diaphragm, obliterating low-pitched sounds. Listen to and try to identify the characteristics of one sound at a time.